Hey folks, welcome to module number 12. Today we're going to focus on chapter 12, and the title of the chapter is Hospital Departments and Allied Professionals. And really what the content for this module is really around is that what kind of legal aspects are there or legal implications to the other areas within the healthcare system. And the text really focuses on hospitals. I thought it'd be helpful for all of us to add a component on managed care because there's legal implications to being a clinician in a health plan. And hopefully you're getting this sense though up to this point in the different modules that there's a lot of risk in healthcare. I mean legal implications are just everywhere in healthcare. And so it's not just the usual cast of characters that you think about when you think about legal aspects. You think about doctors, maybe you think about nurses, maybe PAs, physician assistants, but really anyone can be sued within the healthcare sort of multidisciplinary team. And so it's important to have some high level understanding of that. And so the materials that I have for you this week, they look at a number of different roles that are outlined in the chapter. And I've added, of course, the role of the managed care plan. But they look at sort of the end-to-end process from when a member is needing a first responder right up until while they're getting care within a hospital. And then, of course, the health plan. So it's sort of out of the hospital with the first responder, in the hospital with the hospital team and all the multidisciplinary teammates. And then as that member transitions out of the hospital, and if they're managed by the health plan, there's also management that occurs. So keep that in mind as you're going through the materials. And basically in the modules, there are 4 different learning objectives. Really want you to understand all not all, but many of the different providers of the multidisciplinary team and what some of those legal implications are. Really want to give you an overview of something that's really important around the Emergency and Medical Treatment and Active Labor Act. And so understand that concept. That's actually a discussion question that you'll have an opportunity to respond to. Describe the purpose of certification and licensure and how you can lose your license is one of the objectives. And then looking for what's the importance of really having a multidisciplinary approach to patient care. And that's been out there for a long time. That's no new revelation to folks, but really how does a team work together within the healthcare system? But really even as you're thinking about it, keep in mind how even within the community, as we look at social determinants of health, or as we look at population health, you also want to be thinking about how does a multidisciplinary team or a variety of stakeholders really improve the outcomes of either an individual within the hospital setting or population within the community. So I hope you enjoy the materials. If you have any questions, feel free to let me know. There's a video that I want you to watch I thought was really interesting on how a hospital has, in the emergency room is so, and that's where we're going to start, is with the first responders. And from the time of the first responders to the time of the emergency room interactions, lots and lots of opportunity for errors. There's a lot of stress. There's a lot of pressure. You could have violent interactions occurring. You could have just life-threatening, which require a quick response time, those kind of things happening. So all of that just sets the stage for opportunity for error and for negative patient outcomes. And so the video we will show you, I think will give you a strategy, which I think can be used in a lot of different environments that you may find yourself in the healthcare space, outside even the emergency room, when you're trying to solve a complex problem within the workplace or a crisis comes up within your job. So I hope you enjoy the materials, and we'll look forward to catching up with you next time.